options. And this webinar is proudly hosted by the Neuroscience and Inflammation Lab, ilorin, and on which we have our PI today, Professor Woyele. I'm Evelyn Ananias, and I will be moderating tonight's section as well. And we know that today, if we're looking to strengthen our publication record as postgraduate students, early career researchers, or generally an academician, writing review articles or review papers is one thing that we cannot do without. It's inevitable. So we're hoping that by the end of this session, each and every one of us here will be equipped with the necessary information we need to start writing and writing credible papers or credible review papers. Before we bring in our speaker today, I would like to read his citation to us. Dr. Patrick O. Abolarin is a neuroscientist and lecturer in the Department of Physiology, the School of Basic Medical Sciences, Babcock University, Nigeria. He earned his PhD in Physiology, Neuroscience from the University of Ilorin and has developed strong expertise in translational neuroscience, and particularly with a research focus on neurodegeneration, particularly Parkinson's disease, chronic pain, inflammation, and also neurotoxicology. His work integrates stereostatic surgery, sciatic nerve ligation, and other advanced neurobehavioral paradigms, as well as neurochemical assays to investigate environmental, nutritional, and non-pharmacological modulators of neurological disorders. Dr. Abolari has received multiple international awards and competitive grants, including visiting trainee and outreach grants from the International Parkinson and Movement Disorder Society, Ibro Poster and Prize Awards, and travel and symposium grants from international neuroscience organizations. He has actually actively contributed to neuroscience capacity building through prominent roles in the organization of Ibro ARC and MDS-sponsored workshops, conferences, and advanced training schools, serving as a secretary and also member of several local organizing committees. So beyond research, he is recognized as an engaging educator and effective science communicator with strong leadership, organizational, and mentoring skills. His academic service includes departmental quality assurance, coordination of students, industrial training programs, and also active participation in neuroscience outreach initiatives, including brain awareness week activities. His research has been published in reputable peer-reviewed journals, and outside the laboratory, Dr. Patrick enjoys playing chess, and this interest reflects his enthusiasm for strategic thinking and problem solving. Please join me to welcome Dr. Patrick Abolari as he takes the stage for the talk. Thank you. Dr. Patrick, sir.
Yeah, thank you very much. Thank you very much, Dr. Evelyn. Okay, and good evening, everyone. I do hope I'm audible enough, and I do hope that you can see my screen.
Yes.
All right. Okay. Thank you very much for confirming. Once again, good evening to every one of us, and I welcome you to this webinar series being organized by Neuroscience and Inflammation Research Lab under the leadership of Zobamidele Victor Woyele. So today, we are going to be talking about crafting review articles. What are the options? I have this objective or this aim for this particular webinar, and I will try as much as possible to go in line with this aim. The very first one is to explain different review article options. And number two, clarify when each option is appropriate. And number three, to help researchers make informed choices. So generally, review is all about strategic decision making, and it is expected that by the end, every one of us should be able to understand the options available to us and how to choose correctly. Why this topic matters? Review articles influence practice and policy. And number two, and I have decided to make this particular point a little bit bold, simply because I want to believe at one point or another, we must have been affected by it. Wrong review type is tantamount to rejection. And number three, options are often misunderstood. So basically, many researchers know how to write, but the issue is that we struggle with what type of review to write. This confusion is one of the most common reasons review manuscripts are rejected. With respect to practice and policy, review articles assist us generally to synthesize existing evidence and are often used to inform clinical guidance or guidelines and policy decisions. So because they shape our evidence, it assists us to interpret, give adequate conclusions, and it informs practice and research priorities. And with respect to point number two, capacity or ability to choose correctly is equal to possibility of journals accepting our manuscripts. And I want to believe, being an editor, Professor Oyele will be able to talk more about this as time goes on. And then number three, many researchers assume all reviews articles are similar, differing only in length or format. So in reality, each review type has specific purpose and methodological expectation. And these are the key points or important points that many people or many of us don't understand. But the question is, what is review? We have to start from what review is. That is looking at it from English perspective. What is review? If we look at that word critically, we realize that there are two words there, compound words. We have re, which means again, or which means repeatedly. And then we have another one, view, that is to look at or to examine. The two of them coming together forms the word review. And if we're able to understand what review is, that is looking at it from the dictionary point of view, we'll be able to understand what review article is. In the course of preparation, I asked some people, I took a sample, I asked some people about their understanding of the word review. And I got a series of responses. These responses are the things that I have used to create this word cloud. Some people describe review as critical appraiser. Some said it is analysis. Some people said evaluation, evidence synthesis, judgment, interpretation, assessment, methodological rigor, insight. And I see that all these are synonyms describing the word review. But there is one astonishing answer that I got. The person was trying to look at the review from the angle of you having a detailed or you having an evidence, but you are looking at it with a magnifying glass. And that actually struck me, because for you to have an evidence and then you are still looking at it, it means there are some attributes or there are some traits that such an individual must possess. And the very first one is that for you to look at things critically, for you to evaluate things correctly, you must be patient, and then you must be painstaking in your attempt to look at facts or to look at evidence critically. We have rule of review article in science. It's coming to science now. What are the rules, or what are the significance of review? Generally, review articles are important or are essential to modern scientific progress, simply because they assist us to organize past evidence. Not just that, they assist us to summarize what is known and identify research gaps. And last but not the least, review articles also assist us to set agendas for future inquiries or inquiry, meaning that having identified research gaps, then the next thing that should come to mind is you set forward or you put forward agenda for future inquiry. And I must admit that we have an accelerating growth of scientific literature, which, generally it has created what I call a paradox. Paradox in the sense that now we have more evidence, yet it is increasingly difficult for researchers to synthesize that evidence into coherent understanding. And this is actually the gap that review articles is trying to bridge. So review articles resolve this problem by consolidating, that is one, by consolidating findings, that is trying to bring evidence or results that people have generated from primary data and identifying what remains uncertain, meaning that facts have been established, but you are trying to consolidate in such a way that when people pick a paper, they are able to understand what others have done at a glance. And then it is the responsibility of a review article to help us understand the questions that are yet to be answered, meaning the uncertain facts or uncertain evidences. So how do we write a review article? Of course, we also need to understand that before we talk about a review, there must have been an evidence. And this evidence in this instance is equivalent to our primary data. So basically, review article stems from primary data. So it goes beyond just summary of studies, but it is more like a structured synthesis of existing knowledge written to answer a specific purpose. So secondary research does not generate new data. We have to get that. It only allows analysis and integration of findings from existing studies. So generally, its goal is to answer a clearly defined question by synthesizing available evidence into a coherent conclusion. So whenever we are writing a review article, these 3 points we should bear in mind. The first one is that it is a secondary data. Number 2, it is being synthesized from existing evidence. And number 3, you are writing a review to answer a specific or a defined purpose. And that's what leads us to the question of the day. What review article options are available, and how do we choose among the arrays of options that are placed before us? This single question will guide everything we discuss today. So we have a broad categories of review articles, and I have categorized review articles using these broad classifications because I want to believe we have mixed audience. The very first one is descriptive review. Reviews summarize what has been published on a topic without strict methodological rules. And as such, they are important, or they are useful for providing background, trends, and general understanding. And the second one, which is evidence-based reviews. This one is literally different from descriptive review in the sense that it is more structured and allows, or it follows a more rigorous predefined methods to identify, appraise, and synthesize evidence. So the purpose of this type of review, that is evidence-based review, is to inform clinical practice, policy, as well as decision-making. And then we have number 3, which is exploratory and integrative reviews. This one, broad or emerging topics by combining findings from diverse study designs, and they also assist us to generate new perspectives, frameworks, or research directions. Under these categories, or these broad categories, we have different types of reviews that we'll be talking about one after the other. Under the descriptive review articles, we have 3 basic types of review. We have narrative review, we have mini review, and then we have critical review. The good thing is that all of them, they follow the same pattern, and the methodology applied to writing each one of them, each of them is almost the same. So these ones are the ones that we are most familiar with. So, and it starts with number 1, introduction, meaning that why this review. So basically, this part answers 2 basic questions. That is, what is this topic about, and what does it matter, or why does it matter? We give background to readers, all right, that are lost. So what exactly are we trying to say here? You state the aim clearly. You state the aim clearly, meaning, for instance, you say this mini review summarizes recent findings. This critical review does this. This narrative review does this. So the aim should be defined. So you set the scene and state the purpose of writing the review. And the methods. How did you gather the papers? There is one fact we should remember. It is not structured like systematic review and the rest of them. But even though it is not structural, it must also have, it has methods. For instance, how did you gather the papers through which you are able to generate the review that you are writing? So this is where you explain how you search for studies, but briefly you tell readers which databases you have searched, and then you tell the readers as well the keywords you used in search of the papers or the topics that you are writing, or the topic that you are writing on. Basically, the method part is what shows that the review you are writing was done carefully and transparently. In a search, this is where we have another technique by which we search. And this is another topic, or this is another topic, or another topic of discussion. But at our leisure time, it's something that we can learn, so that we restrict ourselves to what exactly we are searching through the application of what you call the Boolean rule. Right? You combine words together by addition of the word or, and, plus, and so on and so forth. And you apply this either on PubMed, Google Scholar, and all these databases. The application of these Boolean rules allow us to restrict or to confine ourselves to what topic or what subject we are searching for. And then the result is asking two fundamental questions. That is, one fundamental question, what did you find? And this is spread into two parts. It could be quantitative, and at the same time, it could be descriptive. And then another thing that we have to bear in mind is insertion of figures and table in narrative, mini, or critical review. So instead of long text, instead of making the whole review to be text, to be written in text, one of the ways by which we captivate the attention of our readers, or one of the ways by which we make the review very much interesting and at the same time easy to understand and comprehend, is to use figures and tables. So it assists us, or these two elements, that is figures and tables, assist us to summarize studies, and then it also gives us the capacity or the enablement to show trends of patterns. And then we have another section, that is the discussion. This one is answering the question of what does it matter? What is the essence of the review that one has carried out? So basically, this is where we give interpretation of what we have done, and not just report of what we have done. Rather, we give interpretation to what we have done. So in this context, we are able to explain the themes and key papers. Apart from this, we are able to point out what we still don't understand. This is where we point out the knowledge gaps in the arrays of papers that we have gathered and that we have reported. And as such, we're able to suggest real-world application of what we have done, which could be clinical-based, policy, or practice. Apart from this, it is in this aspect or section that we are able to give our recommendation. This is where we're able to project or propose or hypothesize future research direction with respect to subject matter. So basically, these three types of review assist us to summarize and interpret literature review. So we take them one after the other. Narrative review, they are powerful, they provide insight, and perspective. But one important thing that we must understand is that they must be well structured to avoid appearing selective. So basically, a narrative review addresses a broad topic using a qualitative synthesis of literature with a flexible structure that gives authors the capacity to provide background and develop concepts or theoretical insights. But the issue with narrative review is that it comes with what is called author bias. Author bias in the sense that the methodology for gathering data and for writing it is not that structured. And as such, it may be difficult for there to be replication or reproducibility of that particular review by another person. But if we must choose to write a narrative review, then what will influence our decision is that we're trying to explain a topic broadly, build a background, or integrate ideas informally. So if we are able to set this agenda right from the time that we have our topic and then we want to write, then we should know that what we are aiming at is a narrative review. Then we have a mini review as well. The mini reviews are not meaning because they are small, but because they require a focus and they require being focused and being precise. Mini reviews are focused and they are precise. So the focus a narrowly defined topic. And in many reviews, you present the key evidence in concise and streamlined format. And another way by which we are able to identify what mini review is that it is usually through invitations from journals. So you think of it as focused narrative review with strict limits. So it is still narrative, but it is more precise and focused. It's not because it is small, it's because it is meaning as the naming or as the name appears, but because of its precision and because of its focus, we call it a mini review. So if our aim is to synthesize a very specific topic quickly and clearly for an informed audience, then we choose a mini review. Then we have a critical review, which is also descriptive as well. This one goes beyond summarizing the literature by actively evaluating strength, weakness, and inconsistencies across studies. So we make use of selective and interpretative literature analysis without predefined or reproducible strategies, so to put it. And then if our aim is to critique assumptions, methods, and dominant viewpoints, then we set that right from the time we want to write the review. We should know that what we are aiming at is a critical review. And then we have evidence-based review articles. Evidence-based review articles. This pyramid has given us a kind of reviews that we have under this type of review. We have systematic review, meta-analysis, we have rapid review, and then we have umbrella review. So these reviews are driven by method rather than opinion. And now, of course, this pyramid shows that scientific evidence becomes stronger and more reliable as you move upward from the laboratory and animal studies to clinical trials and reviews. At the top, we have systematic reviews, meta-analysis, and umbrella reviews, right? Combining many studies to which is why they are most trusted for guiding clinical practice and guidelines. Systematic review, in this instance, it aims to minimize bias that is found in narrative or descriptive review by using predefined methods. So they are highly valued, especially in clinical and biomedical research. And it follows a strict rule called PRISMA, all right? You have a PRISMA flow where you have identification. That's the very first thing we do. First, you search widely across databases to capture everything that might be relevant about the subject that you are writing about. And then the next thing is remove duplicates. Of course, you have arrays of databases from which you are searching for information. There is every tendency that these sources. The next thing you do is to remove duplicate records so you do not have the occurrence 2 times, 3 times, or 4 times. And then we go by screening. All right, you quickly screen the titles, abstract, or conclusions to further remove studies that are clearly don't answer your question. From there, you are able to check for eligibility, that is eligibility assessment. After this, you read the full text of the ones that you have selected, from where you are able to check whether they actually or they truly meet your inclusion criteria. Then you have your exclusion criteria as well. At this stage, the studies may still be excluded if they lack relevance, quality, or sufficient data. But the long run, you have your inclusion, which is the final stage. Only the studies that fully meet your requirements are included in the analysis. You find out that this type of review is more structured, is focused, and it is precise, and it is reproducible, meaning that following the standard rule, anybody can perform this operation anywhere in the world. And it is, for this reason, it is different from narrative review, which is a little bit biased. And then the key point here is that if our aim is to answer a focused question comprehensively with transparent methods, then our option or our selection criteria should be systematic review. Then we have meta-analysis. Of course, this one is not mandatory, so to put it, but it is only appropriate when the data allow meaningful pooling. So it goes with application of statistical synthesis that allows us to estimate the overall effect size through combination of data from multiple studies, and it is usually conducted as part of a systematic review. So basically, you find out that both of them, they go hand in hand. So what will inform our option for meta-analysis is if our aim is to compute an overall quantitative effect size from multiple studies, then our option should be meta-analysis. Then we have rapid review. This one uses streamlined systematic methods to produce evidence summaries within a short time frame. Although why it is faster, it involves methodological trade-offs and is commonly used to perform or to inform urgent policy on clinical decisions. So again, it is precise, it is focused, and it is not biased as we have in the case of a systematic review. And that was the more reason why it is called an evidence-based review. If our aim is to provide evidence quickly and evidence that will provide urgent decision making, then what we are aiming at is rapid review. Then umbrella review, well, just like the name implies, or just like the name means, it's umbrella. Of course, these ones are particularly useful in mature research fields with multiple existing reviews. Basically, the umbrella reviews or review sits at the top of evidence hierarchy, while systematic review gathers and analyzes all primary studies on a specific question. What umbrella review does is that it goes one step a little bit higher. Basically, it's more like a review of reviews. It reviews multiple systematic reviews on a broader topic. Then we have exploratory and integrative reviews. These reviews are ideal for emerging complex or rapidly evolving fields. And then it goes by identification. We start by searching databases and other sources and collect all possible studies. We screen, that is, we remove duplicates and check titles and abstract to see which studies might be relevant. All right. And it is more theoretical. It is more theoretical. So in this, in this instance, the exploratory review show how many studies are found and how many we are able to exclude. And then it gives us the opportunity to prepare or to give more mechanistic idea about a particular subject. So we have scoping review under this category. We have integrative mechanistic review under this category, and then we have theoretical review under this category. So scoping review do not aim to answer whether intervention works, but to understand what evidence exists. Okay, so it's more systematic in nature, in the sense that it systematically maps the available evidence on a particular topic, and then it identifies gaps in knowledge, plus a broad research question, and provides an overview of the topic. So if our aim is to map the field, clarify concepts, and identify gaps, especially in emerging topics, then what we aim at is scoping review. Then we have integrative mechanistic review. What this one does is that it integrates evidence across different levels of analysis, okay? Emphasizing the underlying biological, physiological, or behavioral mechanisms and pathways that explain how a phenomenon occurs. So, like the name, mechanistic. And then what can inform our choice with respect to this type of review is if our aim is to synthesize qualitative as well as quantitative evidence for a holistic understanding, then what we should aim at writing is integrative or mechanistic review. The theoretical review, it's synthesizing existing theories, models, and conceptual frameworks rather than empirical findings alone. Its aim or its main purpose is to develop a refined or purpose or propose new theoretical perspectives. So if our aim is to advance or integrate theory and construct, then what we are aiming at writing is theoretical review. So how do we choose the right option? Like I have said in summary, the very first thing we should understand is the research question, right? The research question, which is more or less like a narrow specific question, which will suit either narrative, systematic, critical, mini review, as the case may be. Then field maturity, right? That is, well-established fields with many studies may allow meta-analysis, whereas emerging fields may require scoping or narrative reviews. Then available data, okay? And then journal expectations. Some journals prefer high-level evidence synthesis like umbrella reviews, while others accept narrative or mechanistic reviews. Common reasons review articles are rejected. I have experienced this a couple of times, and I want to believe that this is the experience of some of us. What are the main reasons, or what are the major reasons why review articles are mostly rejected? I've been able to identify 4, but like I said earlier on, I believe Professor Oyele will be able to probably give us some answers to this and give us hints. But the very first one I was able to identify is wrong review type. Sometimes we give a wrong review, okay, to journals, and as such, if it does not meet the expectation of the journal at that particular point in time, it results into an outright rejection. And then lack of novelty. Okay, lack of novelty. How novel is our review? Are we just reporting, or are we giving proper interpretation to what we are reviewing on? Are we profiling, or are we projecting, or are we hypothesizing new studies or research gaps? Are we recommending? If all these elements are not incorporated in what we have written, there's every tendency that our article or manuscript will be rejected. And then we have poor structure. Of course, if our reviews are not well structured, there is every tendency for there to be rejection as well. And then methodological mismatch. If we're able to identify each review type, we know the methods to apply in writing each, I think we are good to go. But in a situation whereby you are writing a narrative review and the construct or the structure is showing that it is a narrative review, but you are beginning to see elements of systematic review in narrative review, that's methodological mismatch, and that could as well result into rejection. Most review articles rejections are called before detailed peer review, and often it occurs at the editorial screening stage. So the key take-home messages here, I have 3 take-home messages for us. The very first one is that review articles come in different forms, and our writing should be based on fit for purpose. And number 2, each option serves a distinct purpose. Each option, if you are choosing narrative, mini review, we should understand that each option subserves or performs or serves a distinct purpose. And number 3, choosing the right option determines the impact. Choosing the right option determines the impact. These 3 messages, I believe, will influence our further decisions about the kind of reviews we want to write. At this point, I want to stop, and I want to acknowledge Neuroscience and Inflammation Research Lab for the opportunity to give this talk this evening. I appreciate the leader of this lab, Professor Bamidele Oyele, for creating this platform to deliver this lecture. And I thank you as well, the audience, for your rapt attention. Good evening once again, and thank you very much for listening.
Thank you very much, Dr. Patrick. Thank you very much. We appreciate the insights that you have shared with us this evening. I want to believe that everyone here has gained 1 or 2 things that will equip them going forward in writing review articles. At this point, we'll take questions from everyone that's listening right now. If you have any question, you can drop it in the chat box, or you can just unmute and just say your question. We'll be looking out for questions. Okay. Please don't hesitate to ask questions. Dr. Patrick is still here to answer them for us. Okay, so while we're waiting for questions, I will just ask one. So sir, you've shared a lot about review writing, but I want to know, is there any tool you would recommend that would rather simplify the writing process, after choosing a topic and we've gone through the step of knowing the kind of review you want to write? So what tools would you recommend in writing?
Well, I want to believe that we are now in the era of AI, and I believe there are so many artificial intelligence apparatus that we can use, but I still need to clearly state that I will not recommend that AI should write a review for us, but it can assist us. Okay, it can assist us in our writing. For instance, the other time I said that you can use some Boolean constructs to check. This aspect can be a little bit stressful, simply because you might be limited somewhat. But if you if you are using an AI apparatus and then you type there to help you with some Boolean syntaxes that you can use to search for a particular information, you get series. And I can tell you that it assists a whole lot, either on Google Scholar, PubMed, Web of Science, Scopus, and all that. So it assists in confining. And apart from that, you can as well make use of AI to help you pull some relevant journals. And you have to be careful as well, simply because you can pull this through Excel, and then you begin to open one after the other to synthesize, to know the ones that are important, the ones that are not important. And with this, I believe you are good to go. But specifically, having an AI apparatus that will assist you to write, I don't think I'm aware of that. But if anybody is aware of that, I think you can share with us.
Okay, thank you, sir. Thank you. So,
Hi,
is there any
evening.
question? Okay, good evening. Good evening, ma.
Yeah, evening. How are you?
Yes, ma. I'm fine, ma. Thank you. You
Okay,
can go
good.
on.
My question to Dr. Patrick. Thank you very much for your presentation. My question is, don't you think to write review should be for more senior people? Like, I believe that review should be what you have been doing over the years. So it's easier for you to write a review on a particular topic that you have worked in the area like for some time than just standing up as a young academic. You want to review, and that's why you are needing so much help from AI, copy, and all that. I'm just curious.
Yes, you are absolutely correct. I subscribe to that. You cannot write a review if you're not an expert in the subject area, simply because you should be able to tell if an information that you are getting from different sources, if the information is correct or not. So if one is a young researcher and you are new to a particular subject area, it will be very difficult, I must confess, to write a review. So I believe, like you mentioned, you must have gathered a lot of experience over the years to be able to actually write a review. But having said that, I think it is also good for young or for people that are coming up to at least learn from the senior individuals to know how to go about writing reviews so that it will be easy for them as well.
Okay, sir. Thank you for that. We have some questions in the chat box.
Okay, just a moment.
Yes, the first one is saying, please, could you emphasize on the difference between a systematic review and a meta-analysis?
Well, the basic difference between the two of them is that actually both of them are structured, but the striking difference is that you make use of statistical analysis to further strengthen your point or to further strengthen your review in the case of meta-analysis. But in the case of systematic review, you do not need to make use of statistical analysis to go about strengthening your review or article that you have written. One incorporates statistical analysis of your data, while the other one does not.
Okay, thank you for that. I believe the person that asked the question has gotten a good response. So the second question we have is, what is the minimum number of journals you are to source from for it to be well detailed, for it to be a well detailed literature review?
Well, personally, I want to believe it depends on the aim that one is setting out to, or the question or the research question that the person or an individual is trying to answer. Because usually when you are writing, you should be, for instance, you are searching for a particular information, you should have a length of year or years. All right. For instance, you want to search from 2020 to 2025. And you might as well decide to choose from 2010 to 2025 or 2026. So basically, your research question will be able to determine the length to which you want to go with respect to searching for information. I don't know if I have answered that question.
Okay.
But
Okay. I think we have one more question, but it's in line with the first one. Does systematic review and meta-analysis go together?
no, it's not compulsory. Like I stated, it is not compulsory that you do the two. And I saw somewhere, I don't know if that statement is absolutely correct. And that is, it is not mandatory to write meta-analysis. Meta-analysis is more high level. All right. So the two of them, they are two distinct pathways, but they have two different pathways. Like I said earlier on, one incorporates the usage or utilization of statistical tool or analysis, while the other one does not. So I cannot say categorically that the two of them, right, must go together.
Okay. Thank you for that, sir. Thank you for the answer. I think that was the last question on the chat. So, okay. So what is your advice? We have another question. I think this will be the last question before we wrap up. What is your advice for an early career scientist, like a recent graduate or even an undergraduate? Where can we start from?
Well, just like Professor Damborono asked the other, or suggested the other time, writing review is more for senior individuals, people that have gathered in experience over time in the course of their laboratory experience or research. Having established that, I think one of the ways by which individuals that are young, by which they can learn is to attach themselves or associate themselves with the people that have gone ahead, the senior individuals, and learn how to go about writing. I think with this, they will be able to learn. There's an adage that says you stand on the shoulders of giants so that you can see far. Review is not something you just jump into and write. It's going to be very difficult for such an individual to write simply because the experience is not there. But the more you associate with yourself with someone that has gone ahead of you, I think it will be very much easy to pick cues from them, and then you see the style of writing, you see the way they learn, the way they write, and with that, as time goes on, you'll be able to write effectively as well.
Okay, sir. Thank you very much for that. Do we have opportunity for one more question? We have one more here, and it's saying, between book chapter and review, which one would you recommend for students to start with?
Between book chapter and review.
Yes, book chapter and review.
Well, I recommend the two. As long as you have gathered experience, as long as you have the expertise in writing, you can go ahead and write. The two. Well, perhaps I don't want to preempt, but I believe if it's on the basis of promotion, I don't want to go too much into that, simply because there are required number of review articles that you can submit. There are required number of book chapter or what have you that you can submit for your promotion. But I am not going into all that now. But if it is to gain skill, I recommend the two. But the bottom line is that before you can write either, you must have gathered enough experience. Like I said, it is not primary data. Or primary research that you go into the lab and then you report, right, what you have found out in the lab. But you are synthesizing ideas, you are reporting, you are interpreting, and then you are profiling solution, you are identifying knowledge gaps. So it requires time for you to be able to spot all these elements. So I recommend the two as long as you have capacity to write them.
Okay, sir. Thank you very much, Dr. Patrick. At this juncture, I think would draw the curtain here. We want to appreciate everyone for joining in today, and particularly Dr. Patrick for sharing from his wealth of experience with us. I'll just give opportunity to Professor Wayeli, PI, to give the closing remark and we end. Thank you.
Thank you, Dr. Patrick. I'm so happy. I think you have done so excellently. You've made the lab proud. And I think people have been saying that I've been sharing some of this slide. Dr. Patrick concluded his PhD with us last year. Is it last year or the year before?
2024, 3 years ago.
2024. Okay, so okay, so 2024, and he's been doing so wonderfully. I want to thank Miss Evelyn. Evelyn has also anchored this so wonderfully. Evelyn is a master student in the lab. And maybe before I go on, I'm displaying something on the screen, which is a review paper. And you can see that I am number one because the concept was for me. I gave a talk in Babcock, university, and I decided to turn that talk into a review. And Bola, the second author, was a youth corper, so just like a BSc holder. And then the third was also a youth corper too. So, and then Patrick is there. So all of us were involved. So those who are asking for early career, I mean, you have to work with a senior person, and then you can always come out with something, and that is how to grow. So Patrick has appropriately learned the trade and the trick, and I'm sure that even as the PI, I benefited immensely from the different type of review that he has brought forward to us this evening. I want to thank him and thank everyone that it's not that he's just speaking. He has been involved in doing review. I think I projected one that we had with Hebrew Neuroscience. You won't believe that it cost us, I think, 1,500 US dollar to publish that review article, but we are proud of it. So I want to thank a few people here. I want to thank my immediate past president in the SSPA, Mama, Professor Akimpelu. I'm so honored to have you attend this. Maybe if you want to say one or two things later. I want to thank my current president at the Neuroscience Society of Nigeria, Professor Angela Dambrono, Dr. Dada, the secretary for the SSPN, and then Professor Miriam Anila, who is my first PhD and the first mentee to become a professor. Another one became a professor just today, Professor Nafil. And then we have the many other people. We have BSc students, we have master students, we have PhD students, but especially let me recognize Dr. Cordelia Iyare, Dr. Azubike, Dr. Obina, and many other people that have come here to listen to us. We hope to keep doing this because this is very important for development. I want to thank everybody. I don't know if Mama Akimpelu want to say one or two things.
Good evening, everybody. I'm happy to be here, and I have also learned, although I did not join early enough. But the little I listened to, I must say I'm very much impressed by the presenter. I will not mind the copy of the recording of the presentation. I'm proud of our president in SSPN. Is a man of many parts and he's in charge of so many groups. Congratulations, Professor Buyeli.
Thank you.
And I promise to join your webinar in the future.
Thank you.
When you advertise it on our platform. All the best, everybody. Good luck.
Thank you very much, Ma. We are so
welcome.
grateful to have you. Dr. Adidamola, you have a question finally before we leave?
Good evening, everyone. Though I didn't join the presentation from the beginning, but the little part that I listened to, I felt I've actually missed a lot. So I would like to ask if this is recorded so that we can go back to it and listen to it and see what we can benefit. Thank you so much, sir.
All right, thank you, Dr. Adidamola, also a product of the laboratory, thoroughly groomed, BSc, MSc, PhD from my lab. So you're welcome. We have this recorded, and then so we'll try to share it. Thank you, everybody. I think I hand over to Evelyn again to round up or to close.
Thank you, sir.
Okay, sir. Thank you, everyone. I think we can draw the curtain here. We really appreciate your presence. Thank you to all our mentors for joining in and for everyone. Do have a good night rest. Thank you.
Yeah.